Charles, tell us, what has IHE achieved during the past years?
It has been 18 years now since IHE started. I would say three big phases. A phase where IHE explored the world and set its reputation. A phase where it really created its assets. And its assets are, I would say, 10 profiles that became widely successful across the world, a whole testing environment, a set of tools, a well-accepted connectathon. We get now 350 vendors that are registered in the connectathon database. And then a third phase, which is the present phase, where we actually have uptake by the market, deployment, and I would say heavily in the regional and national e-health domain. That is quite impressive. I would say 15 countries are doing IHE around the world. At the national or at the regional level, at least 2 or 3 regions. So that's significant now.
So you said 15 countries.
15.
If you put that in an international context,
Yes.
is that comparing the US to Europe? What are the core differences between the US and Europe?
Europe has 5 or 6 countries that are heavy adopters.
Which are?
France, Switzerland, Austria, Holland at the regional level, but with many regions. Italy with about 3 regions. Some more fragmented region or countries that are doing specific project using IHE, like Denmark recently has done a significant implementation for home device data using IHE profile to collect and assemble that data. UK at the local regional level. The second wave after the big national program is actually a wave of IHE implementation. Germany, a few regions emerging. The US, today, 125 million US inhabitants are interconnected, their health record interconnected by IHE. Little known, massive deployment of national backbone in the US, all using IHE profiles. Quite successful, now finally recognized by meaningful use that try to take shortcuts into so-called simpler approaches that proved more complex. So Canada has a good number of IHE-based region and deployment. This number is increasing every day. Japan will, a year from now, put a mandate on reimbursement based on 5 IHE profile for national deployment. This is in the works and has been basically decided. Chinese deployment, some deployment in Australia as well. So we see, especially Middle East, Saudi Arabia national program has adopted 15 profiles. They're all spec'd, ready to be procured. So we're seeing so many of those countries and regions adopting and deploying. That's the amazing phase. That's the current phase.
So you're mentioning simpler, quotation marks, approaches. You're mentioning home care in Denmark. Are there approaches which are like competing with IHE's approaches?
I would say if you look for a most consistent and recurring use of interoperability, IHE is the clear winner worldwide. You then have a number of standards that are popular, that are used and reused, but all in incompatible and different ways. So if you want to look at consistency, you essentially have about 40% of e-health in the world which is riding on IHE, and the rest, the other 60%, are all 1Z, 2Z little things. They may use the same standard, but in so different ways that there is no compatibility between them.
So what's the hot topic here at the IHE Connectathon Luxembourg in 2015?
The hot topic is the fact that we are now a victim of our success. Victim in the sense that vendors are getting worried. When they build a product using IHE profile, they have to test in country A, region B, country C, region D, and it's the same profile they are testing over and over. The region are saying, oh, it's a lot of testing work. So IHE decided to listen to both sides and to say, why don't we factor the testing of the IHE profile outside of those projects and do it in a way which is of the highest possible quality, ISO 17025 accreditation under a completely defined quality scheme that IHE is publishing and that anybody in the world can read, review, and compare, and deliver a test report that is of international quality, international recognition, so that a project says, oh, you already have conformity assessment for those 5 out of my 6 profile. I will test you only for my national extension or my regional extension. I don't need to retest you for the rest. That reduces my task as a project. The vendor says, wonderful, I will test for 1 day instead of 1 week. I like it. And guess what? More speed, more quality. In the end, it brings interoperability closer and quicker to the patients that are still waiting.
So we're basically talking about a comprehensive checklist and a certificate?
Exactly. We avoid using the term certificate and certification because it is so much abused by in various places. We call it a test report, which tells you exactly what has been tested. It's all disclosed. You can verify the test plan. You can verify the test tool. So it's a test report by an accredited laboratory. And they have 3 laboratories right now, 1 in the US, 1 in Europe, and 1 in Japan. And we expect 3 or 4 more laboratories. So we leave freedom to the vendors to choose the laboratory they prefer.
How are the users and how is the patient going to profit from all this?
Shorter projects, more reuse, less redo the same thing that has already been done. We are lowering the cost of e-health. Therefore, we're making e-health more affordable for the providers, for the region, the nation, and therefore allowing the patients to finally see their records following their health delivery. That's a big advantage.